How has Paul Rudd managed to stay so young looking? He's known for his charming and seemingly ageless appearance. Paul Rudd has been a household name for over 20 years. But has plastic surgery ever played a role in keeping the actor looking so youthful? Make sure to watch till the end of this video to find out all the potential procedures the actor may have had over the years. In 1992, at the age of 23, Paul has equal horizontal thirds of the face. He has slight signs of frontotemporal recession. Paul has left eyebrow ptosis compared to the right, and possible left eyelid ptosis as well. He has natural tip bulbosity. He also has a soft gonial angle, but a prominent chin. In 1993, at the age of 24, Paul has a relatively thin upper lip. Paul also has full upper tooth show on smile. In 1994, at the age of 25, you can see here that Paul has some under eye hollowing. Almost all of us have these in our 20s, and it's not necessarily an indication of an aged face. And it's also not a reason to necessarily run and get plastic surgery or injections. In 1995, at the age of 26, you can already see some static wrinkles forming on the forehead and the glabellar area. In 1996, at the age of 27, Paul has a dorsal hump that is visible, but his nasal dimensions work well with his stronger chin. And in 1998, at the age of 29, you can see that Paul has been experimenting with various beard styles. In the year 2000, at the age of 31, I see that there's increased upper eyelid hooding, and that is usually a combination of gravity, skin expansion, as well as the brows starting to droop. And it's not severe enough here, but in some cases the field of view can be impacted, and then people might choose to get a procedure such as a blepharoplasty or a brow lift to improve their field of view, and insurance companies will often cover those types of procedures. In 2005, at the age of 36, Paul has this triangular patch of hair that's missing between the mustache and the cheek hair, and this is a common type of phenomenon that I see in my practice when people come in looking for a beard hair transplant. Oftentimes they'll have this little missing gap. Sometimes it is filled in and some people want it filled in, but many patients actually want to recreate that missing triangle there. And it's not clear why exactly. There's no hair in that area for most men, but that is very common. But some people naturally have a filled in area there. I think it allows for a better distinction between where the mustache ends and where the cheek begins. Before we continue, make sure to subscribe with notifications on. In 2009, at the age of 40, I see that there are some signs of weight gain, and you can really see it in the midface and in the submental area. That's a question that I often get, is what can we do about this area underneath the chin, essentially in the central neck, to improve the contour? And we made a video a little while ago that addresses all the different options that there are, so make sure to check that out. In 2010, at the age of 41, I'm seeing some early minimal jawline skin laxity right around the jowls, but it's very minor. And you can see that Paul has great skin, so he clearly does a lot to take good care of his skin, and that usually includes proper cleansing of the skin, proper moisturizing, as well as good sunscreen protection. In 2011, at the age of 42, you can see that his weight has declined based on his facial composition. And changes in our weight can affect the way we look. Sometimes it can make us look older if we gain weight, other times it can make us look younger, and vice versa. Weight changes really do have a significant impact on how we perceive our own age and how we perceive the age of others. I think in Paul's case, as he loses weight and the face gets thinner, he actually tends to look younger, in my opinion. In 2012, at the age of 43, I'm seeing that the hairline has remained extremely stable. Perhaps he's been on finasteride this whole time, or maybe he just has great genetics. But for most people, by the time we hit our 40s and 50s, there's more significant signs of thinning of the hair and continued recession compared to what I'm seeing with Paul. So maybe he has been on some medical therapy. Keep in mind that with medical therapy, the only type that's truly preventative is finasteride or its stronger cousin dutasteride. To find out more about these medications, head to feelconfident.com. And in 2014, at the age of 45, there has been additional weight loss from what I can see. In 2018, at the age of 49, there is some platysmal banding that's visible in the neck. Remember that the platysma is a continuation of the SMAS that we see in the midface. As you head down into the neck, you start to experience the platysma muscle. And when we do facelift surgery, the midface with the SMAS and the platysma is lifted together as one complex in order to restore the positioning of various elements of the face and neck. You can also see in Paul's case that there's continued descent of the lateral brow. And that's because of the temporal line that runs right through here. And anything lateral to the temporal line sees less support, and so it droops more over time. And that's why when it comes to brow lifting, there has been a shift more towards lateral brow lifting as opposed to complete brow lifting, because it tends to be a more natural type of outcome. In 2020, at the age of 51, I'm seeing some temporal thinning. And that's right here in this temple area. There's just more hollowing and thinning. And that is what happens to most of us as we age. Now, some people go in for filler injections into that area. But one of the big mistakes that I see is that people get overfilled, and now the temple is projected more lateral than the lateral aspect of the cheekbone. And that ends up looking very unnatural. In 2021, at the age of 52, I'm seeing some signs of potential under-eye filler. To me, he has fewer signs of hollowing than he did when he was much younger. Remember, with under-eye filler, you want an HA filler that is not too hydrophilic or doesn't absorb as much water as some other fillers. So the most commonly used one would be Restylane L, and now Restylane also has a eyelight filler that is specifically designed for the under-eye area. And in 2022, at the age of 53, I'm seeing some signs of potential veneers. There's some improvement in his pearly whites. And in 2023, now at the age of 54, I'm seeing no signs of additional changes. And so I just wanted to say here that Paul Rudd has aged remarkably well. And there are different potential reasons for this. Of course, genetics plays a role. Some are just born luckier than others. But surely healthy living is another big component of this, and that includes physical well-being as well as mental health and proper dieting. Also, the way that we care for our skin is extremely important for optimizing the aging process. And tastefully done non-surgical procedures or surgical procedures can in fact keep us looking fresh and rejuvenated over time. And maybe it's not a coincidence that one of Hollywood's nicest guys, who seems like a great family man, is aging extremely well without plastic surgery. And the total cost of these potential procedures is $35,000. Since you like this video on Paul Rudd, check out this other celebrity facial analysis. Let me know who you'd like me to cover next in the comments below.